Your radio is about to rock. More of Just Jenny with Jenny Hutt starts now.
All right, let me welcome to the show Dr. Ken Redcross. He's a concierge physician and an author. And first of all, how did you make the pivot to being a concierge doctor, which I think is great? Your website is Dr. Ken Redcross and powerofd.org. And on Instagram, you're at Dr. Ken Redcross. Also the best name for a doctor ever. I mean, the best name. I mean, ever. But how did you make that decision to sort of pivot into concierge medicine, which I think is the wave of the future? I think it's, I always say that, like, if I'm going to spend money on a pair of shoes, and I believe in healthcare for all, and I think that's all very important, and everyone should have access to really good healthcare. But if I'm going to spend money on a great pair of shoes or a great bag, why wouldn't I spend money on my health? And I'm, a neurotic wreck. And so I need to be able to text my doctor. Like, I'm not comfortable if I have to wait a week to get someone on the phone for some weird thing I found.
Well, you know what, Jenny? It shouldn't be that way, right?
Right.
You should be able to have a good relationship with your doctor. As I always say, a doctor should feel like a member of your family. And so, look, I shifted, almost 10 years ago because, guys, healthcare wasn't good enough. In other words, I had patients that they wanted me to see when I was in the big medical group, see 30 a day and so forth. But that's not filling. That's more about volume than value. So my concierge practice allows me to bring value to everyone and bring happiness and health, as I always like to say.
Yeah. And I know you wrote a book about this, about relationships with your doctor. Yeah. And I know that we're going to talk about some inequalities and disparities in health and specifically with COVID, which we've been talking about a lot on my show because it's unbelievably outrageous and disgusting. Yeah. And so let's get into that a bit because, again, it almost, when you think about the statistics and how many Black and brown people died from COVID or weren't taken seriously or historically aren't given adequate health care, statistics like a Black woman trying to get pain medication is really less likely to be given pain medication. It's so distressing and upsetting. And now because of this pandemic, it's like nobody can close their eyes anymore to it.
You can't anymore.
Real.
You're absolutely right, Jenny. It's kind of a big light shown on the healthcare disparities. Now that's way back in I've been in practice almost 20 years. And actually I remember 20 years ago, that sort of thing still being talked about, but now it's real. It is here. And the good thing is we're having this discussion now, Jenny. So hopefully that will lead to change over time now that we're actually kind of putting it all out there and just being open and honest.
Yeah, no, we have to be because I think that if people, I told the story before that a friend of mine had gone to the doctor for persistent headaches and migraines and she's Black and the doctor had asked her if she was a victim of rape or some sort of, just went right down this road of talking to her as though she came from the hood. Not that it should matter, by the way, whether you come from the hood or you don't.
Yeah, but I know what you mean. Sure.
And by the way, she's a crazily educated lawyer. I mean, and on every level, it was just, she said she never wanted to go back to the practice because this one lawyer completely racially profiled her and didn't want to treat her appropriately. She was like, I wasn't sexually assaulted. I've not gone through anything. Like, I have headaches.
And you'd be surprised how much that conversation is going on around the entire United States, Jenny. Those sort of things they just bring almost tears to my eyes because there's such an education piece that has to take place, right? It all starts with education, even obviously at the doctor level. To understand that, sometimes there's some bias that you don't even recognize. That we need to speak about and have some real dialogue around.
Yep. So let's talk about COVID, where we are now. I know that people are finally starting to get vaccinated, and in the next 6 months, hopefully, we'll have most people who want the vaccine vaccinated. But I think we've learned a lot about immunity, about keeping safe distance in general, about washing hands and mask wearing. While way too many people have passed away from COVID-19, there's been less incidences of the flu and of the colds and sort of the day-to-day. And that's in part, I think, by the social distancing and the mask wearing and all the sort of staying put. But I know I take vitamin D every day. I've taken it for years. There's certain things that I take, vitamin D, vitamin C, for years because I don't get enough sun or whatever, and vitamin D is just
Sure.
good for you. But I know you have a whole thing about that. So get into that a little bit.
Yeah, guys, the reason why I say that is that when we were going through our childhood, we always talked about vitamin D. It was a bone story then, Jenny, right? Milk does the body good. Keep in mind, milk is fortified with vitamin D, so it's not a natural source. But more importantly, the story about vitamin D now is the support for our immune system. Almost every immune cell in our bodies have a receptor for vitamin D. That's why that's important. And why do we bring it up now? Well, because we're dealing with the coronavirus. And when you look at the 4 disease states, Jenny, that the coronavirus is preying on, it's heart disease, lung disease, diabetes, and obesity. Very common throughout everyone in the U.S., but especially through certain communities. So if that vitamin D level gets up to where it belongs, it's important. But you don't know any of this unless you get your levels checked, whether it's at your doctor. They have some of these cool websites, thepowerofd.org. You can get an at-home test kit sent to you, which is pretty cool.
Yes.
So there's no reason not to know your level. So I kind of make it a game with my patients and say, get on my level. And by that, I mean vitamin D level between 40 and 60. That's kind of the sweet spot, Jenny.
Yeah. Okay. So 40 to 60 is where we should be. So what about the fact that there's some people that say that vitamins are not anything more than expensive urine, that they don't, that supplements don't really help? I mean, I don't agree with that just because like anecdotally, like I've taken the same hair supplement for 10 years and it changed my hair. Like years ago, but for real, like I had lost a lot of weight and some of my hair came out, and because that can happen when you have like hormonal shifts in your body and you change your body chemistry. And it wasn't until I started taking a supplement, and it took like 9 months for it to start to work, but it really, it worked. I mean, I don't believe in taking in 1,000 things, but like vitamin D, I take every day.
Yeah, that's kind of a no-brainer at this point. Look, everyone, if you don't know your vitamin D level, you're kind of walking in the dark. Look, we have good studies around vitamin D, and it's important, especially if you're really low and what happens when you're able to increase those levels. There's some good data as far as not only the coronavirus, not for treatment, but for the association of mortality or how bad your exposure is. We know it supports lung function as well. We know that it has a role in helping to regulate insulin levels. So the good thing about vitamin D, this isn't something you're just peeing out, as you said, that's turning your urine
expensive urine.
Yellow, dark yellow, expensive urine. No, guys, the good thing here is that you can kind of hang your hat on the fact that, you know, this is necessary and good stuff. Look, vitamin D is so important that the good Lord allows you to create it yourself from the sun.
Right.
That shows you how important vitamin D really is.
Yeah. And are there other things we should be taking in terms of COVID prevention or anything else? Like, how do you advise your patients now, aside from, I mean, everyone in my life, like my brother lost weight so that he got himself out of the obese range during this pandemic, because that's a comorbidity. Like, you do not want to be heavy and get COVID. People are checking their blood sugar levels because it's right. Diabetes is one of those things that weakens your immune system. Heart disease, that's another. You don't want to potentially have this attack your heart. They know there's clotting that happens. It's an inflammatory virus. I mean, it's just so what are some of your recommendations for people listening for staying healthy while they're waiting to be vaccinated and even getting vaccinated? It's not a guarantee that there won't be something else, and it's not a guarantee that you're never going to get something. So what can we do?
No, you're right. And one of the other things that's important, and, you know, we kind of gloss over it a lot here, Jenny, because in America, we always think that less sleep means that you're a harder worker. And that's just the opposite.
Yeah, no.
Sleep is truly medicine, everyone. We're supposed to get 7.5 hours. And picture this. Imagine you guys, when you guys were in college or school, you go out with your friends, you hang out till 4 or 5 in the morning. What happens when you wake up the next morning? You feel crazy. Your nose is runny. You catch a cold. All of that is because sleep is perfectly intertwined with our immune system. So you got to make sure you're getting enough rest. The other thing, look, we mentioned vitamin D, but there's also omega-3 out of fish oil. Incredibly important for that inflammation that you talked about, because inflammation leads to disease, or as I say, Jenny, I call it dis-ease. So we need to make sure we be a little careful about that. The other thing is a little bit challenging now, and this kind of hurts me because it's that disinformation campaign that's out there. Yes. I have 2 or 3 patients. These particular patients, it happen to be African American, But the interesting thing is they got these really well produced videos, separate videos, one in North Carolina, another one out in California. But the videos show someone getting a vaccine. They say how happy they are. And next thing you know, they pass out.
Oh,
and
please.
Then they give you and then they give you all this dialogue. So-and-so died after that. Not true. So that gets back to that patient-doctor relationship, being able to give a call to your doc and say, Doc, this is ridiculous, right? Let's talk about it. But that's the stuff that I want everyone to be cognizant of and make sure that we're also slowing up on the travel piece. Look, I get it, Jenny. I want to get out of this house too. We're almost there. So just kind of.
Agreed. Oh, I'm with you. I know.
Go to these places, you know?
Oh, yeah. Oh, this is the conversation we have in my house all the time. I have one kid in school, one kid who finished school from home. The kid who's away at school is going to come home for a few weeks. We do all the quarantine. You know, we do everything you're supposed to do. We have not gone away as a family. We haven't done anything. I don't go anywhere. I get a manicure. Yeah. That's what I do. I go to one manicure store. And that's it, with partitions, with masks, with taking temperature, with doing it. But other than that, we don't go to restaurants. We don't do any of it. We stay home. We've stayed home for over a year. And that's fine. Like for a year. That's how it's okay. And so I say the same thing, like everyone who's like rushing out, like I have to get out. I have to go to the big city. I have to do this. I have to do that. I'm like, you really don't. Like, you're fine. You're okay. Yeah. You can like wait another whatever before you're hanging out and you're big, like going out to dinner with all the couples. Like, who really cares?
Not only that, Jenny, you know, I try to also, you know, one of the things that if people look me up and know who I am, I'm always positive. I don't believe in negativity no matter what. Yeah. And so if I had to take something from the coronavirus and say, hey, Doc, what are you talking about? Coronavirus has been horrible. Well, that's true, everyone. But how long ago were you guys able to spend this much time with your family?
Yeah, not
for better
never.
Or for worse.
Right,
for
never.
Some families, right?
Of course.
But never. And that's the takeaway here. You know, I have a set of twins at home, Jenny. So I'm going to have gray hairs in no time.
How old are they?
They're 15. They're 15.
Yeah, that's rough. Boys or girls?
Yes, rough. One of each. So I get a dose of
God, I'm
each.
so sorry.
I know.
Yeah, no, it's a lot.
I'm putting the cross over my head as we speak, okay?
You need to. I'm so sorry. That is 15 is hard because I have 22 and 20, almost 21, and it's hard.
So you get it. So 15, you get it. But the point is,
I get it.
The time we spent together, Jenny, when
wouldn't
we
have had
gotten years, ever.
Yeah, my daughter was home until January. She didn't go back to school until January. My son never went back to school. So it was we were all locked in the house for a long time, and it was magical. I mean, there were days that we were all going to kill each other, but like we would never get this and the sleeping thing. And I don't know how you advise your patients, or especially the mothers. Like, it's very hard for me to sleep at 51 years old. Either I'm worrying or I'm just up to pee, or my hormones are just keeping me awake. Like, I don't take sleeping medication. Like every 6 months or 3 months, I'll take 0.25 of a Xanax, and then I'm drunk the next day because I don't drink alcohol because I don't like it.
You get the hangover,
I get the hangover. I mean, I've been on the air with the hangover, and everyone laughs at me because I'm not a pill popper, so I really do get it, like, but it makes me sleep. So I don't know what, do sleeping medications help or do they hurt?
Well, look, guys, so I'm not a fan of medications, to be honest, Jenny.
Sure, of course.
My goal is not to use my prescription pad, as I tell everyone. So there are a couple of things. Number one, we have to figure out whatever your form of exercise is or what have you. It can be very, very important, not only to increase that endorphin surge, but you also come down nicely to get rest. But for those of you who are on the natural side of healing as well, our body makes melatonin, right?
Yeah.
Through the pineal gland. And so therefore, that's available in a natural way to make a big difference, Jenny, to really normalize a lot of sleep patterns. It tends to either work really, really well, or people will say, a little bit, doc, but not perfect. But that's something that we can reach for that's natural, as I like to say, closer to the earth, that can kind of make a little bit of a difference. In addition to bringing in some mind-body stuff, I'm a really spiritual person when it comes to kind of knowing thyself and having that moment for yourself as well, which is a meditative sort of state, which can help also.
Okay. And in terms of vitamin D, are there brands that you recommend, or really any that's from a reputable company?
Well, thank you, Jenny, for saying that, because I don't recommend all these brands. The one thing I say is make sure you go to a source that is vetted, depending on where you guys are listening in the States. So that could be Whole Foods, it could be Sprouts, or Vitamin Shop. The point is you want to go to some place that is vetted, because they are really part of the charge to lead to wellness. The levels that I typically see that work well for folks to get them to that 40 and 60 tends to be between 2,000 and 5,000 international units. But once again, Jenny, you don't know that unless you go ahead and get your levels checked, whether it's at that site that's kind of concierge, the powerofd.org, or whether it's with your doctor now, which is easier than it was in March and April. But once you do that, it's a little bit easier to know where you are.
Thepowerofd.org. And also now they have a bunch of labs, a bunch of companies I've noticed, like Quest Diagnostic. You don't need to go to the doctor to get certain blood tests ordered. They can do it virtually, and then they just put the results right in your inbox, which you have to know how to understand them. And it's better if you have a medical practitioner helping you through all that sort of thing.
Really,
I mean, there was, oh my God, I was going through some like weird blood. I'm fine. I'm totally fine. But I was getting like blood work results before my doctor was calling me with them. So I was like, what does this mean? How do they send this to me without my having you to explain it? And my doctor was like, I know. Like they were like, I'm so sorry. We don't have control over that. They just throw it in your inbox. Yeah. Don't look. And I mean, literally like MRI results were showing up in my freaking folder. And I'm like, I'm not reading my MRI results.
I know.
No
it's
way.
But it's dangerous, especially, Jenny, when you see these big words in there that you've seen on the soap operas, and you're like, hold on, I don't want that in my report. I'm not
reading this. Totally. Exactly. And I'm like, no way. But so you can, something like vitamin D, you can find that out. And also you feel better when your levels are right. When you have, and so checking certain vitamin levels are good to do. Like there's just no reason not to. So you say between 40 and 70?
60?
Oh, 40
no,
and 60.
Between 40 and 60. And the reason why it's important, guys, we can't test our immune system, but we can test our vitamin D to know where we're living. Where are we?
Right. No, and this is really, I think if anything we've learned from this pandemic, like you want your immune system to work as well as it possibly can. I mean, that's what you want. So that, because they still don't really know, right? The whole medical community still doesn't really know exactly why the comorbidities do what they do. Right? Like, what
happens, what the interesting thing, as I mentioned, is that they all were associated with vitamin D deficiency, all those disease states. But look, we know where the virus enters now and what sort of receptor it latches to. The problem is that receptor that it latches to does terrible damage as far as the sprinkling out of the cytokine storm you guys all hear in the news. And so it's that inflammation picture again, Jenny. And so that's where this particular virus does its damage. And so that's why we kind of need these other new things to bring in to make sure that we can stay well with all the stuff that we know that we're doing already.
Yeah, no, it's definitely crazy. I mean, I've heard from, and obviously people should check with their specific doctors, but across the board, I've been told vitamin D from the start. I've been told things like having Pepsid at the ready is a good thing to have because it's an anti-inflammatory drug in your gut. I don't know. I'm not a doctor, but sort of some people take baby aspirin. I mean, there's all sorts of because this virus makes your blood tacky. And it's just, I look forward to everybody being vaccinated. And you're right, that freaking weird propaganda bullshit with people getting the vaccine and passing it, it's just not true. Like, it's just not true. And I don't want people to think it is.
Exactly. And that's the whole point, Jenny, to be able to talk to your doctor specifically about some of the things you mentioned, the Pepsi, the aspirin. Talk to your doctor, see if that makes sense for you, your situation. What's best. But once again, it's about that relationship. The 4 things I talk about in that book that are important, Jenny. Trust, respect, empathy, and communication. You got to have all 4 of those to create what I like to call a patient nirvana, to have that perfect relationship.
Yeah, I want to mention the book is called Bond, The 4 Cornerstones of a Lasting and Caring Relationship with Your Doctor by Dr. Ken Redcross. And people can check out drkenredcross.com and powerofd.org. And then they could follow you everywhere on Twitter. You're at Ken Redcross MD. On Instagram, you're at Dr. Ken Redcross. And I think it's great that you're spreading this message around and doing what you're doing. Stay healthy.
Oh, thank you, Jenny. Thanks for having me on. Stay well, everybody. Happy Friday.
Yeah. Good luck with those twins. Take care.
Thank you. I'm going to need it. Thank you, Jenny.
Bye-bye. See you. Bye.